Rohingya community faces critical humanitarian crisis under Arakan army control in Rakhine state. The Rohingya community in the Rakhine state of Myanmar is currently enduring a dire humanitarian situation, exacerbated by the ongoing conflict and control of the region by the Arakan army, cut off from vital supplies, including food, medical assistance, and clean drinking water. The community's plight remains a major concern as international efforts to provide aid are severely hampered. Humanitarian crisis unfolds according to local sources and aid organizations. The Rohingya population in the areas controlled by the Arakan army is facing extreme shortages of essential services, with roads blocked and aid agencies restricted from accessing the region. Tens of thousands are now living without medical support, food, or clean drinking water. Pregnant women, children, and the elderly are particularly vulnerable. Our children are starving, and there is no clean water to drink. If we get sick, we have no doctors to turn to, shared one local Rohingya resident who asked to remain anonymous for fear of reprisal. Arakan Army's control, a complex geopolitical reality. The Arakan Army, an ethnic Rakhine insurgent group, has gained significant control over large parts of northern Rakhine state after intensified clashes with Myanmar's military. While their struggle for autonomy and the protection of Rakhine rights has garnered sympathy among some local ethnic groups, the Rohingya, an already persecuted minority, continue to suffer under harsh restrictions imposed by the AA. Human rights groups have called attention to the fact that the AA, like previous regimes in Myanmar, has shown little effort in ensuring the safety and well-being of the Rohingya. There is a grave concern that the Rohingyas suffering under AA control is yet another chapter in their long history of persecution and neglect, said an analyst from a Myanmar-based rights group. International efforts stalled despite repeated calls for intervention. International humanitarian organizations face immense challenges in providing aid to the Rohingya in these areas. The Myanmar government, the Arakan army, and the ongoing civil war have created logistical and security barriers, with the AA reportedly blocking aid convoys. We are ready to deliver assistance, but the situation on the ground is making it nearly impossible, said a representative from a major international humanitarian organization. The UN has issued several statements urging all parties involved to allow unhindered access to affected populations, but so far, these appeals have gone unanswered. Health, food, and water scarcity, immediate needs. Reports from within the Rohingya community highlight an escalating health crisis. Without access to proper healthcare facilities, people with treatable conditions are succumbing to diseases such as dysentery, pneumonia, and malaria. Malnutrition is widespread, with food supplies either blocked or priced far beyond the reach of most families. Water sources have also been contaminated or cut off entirely. Many families are forced to drink from unsafe rivers' water, leading to outbreaks of waterborne diseases. The situation is particularly concerning as the region faces the upcoming monsoon season, which could worsen the public health crisis. Calls for international response. Rights groups and activists are now calling for immediate international action to address the Rohingyas' deteriorating situation. The Arakan army must be pressured to open humanitarian corridors, while the international community should prioritize diplomacy to resolve the ongoing conflict. The Rohingyas' future remains uncertain, but their suffering must not be ignored. As the conflict in Arakan state continues, the Rohingya community is left in increasingly desperate circumstances, deprived of essential services and basic human rights. International organizations must urgently address the humanitarian crisis unfolding in the region, ensuring that food, medical supplies, and clean water reach those in need before the situation worsens. Without timely intervention, the Rohingya face further marginalization and deepening tragedy under Arakan army control. By Ahmed Arakani. The Arakan Associated Press.